Now we're going to move on to the next presentation, which will be done by Chris as well. And this is titled Basic Immobilization Principles of African Elephants, the largest animal, land animal. Yeah. So by the end of this presentation, you should be able to understand why immobilization is necessary, the risk involved in it, and how to minimize stress and injury to elephants during capture operations. Secondly, you should be able to understand appropriate drugs, dosages, darting techniques that are used in elephant immobilization. Thirdly, you should be able to recognize the correct posture, airway management, vital parameter monitoring, and prevent vital parameter monitoring to prevent complications during recumbency. And lastly, you should be able to describe post-immobilization care, recovery, and transportation procedures for the elephants. Thank you so much. Now I'm going to hand over to Chris. Dr. Chris, welcome back, Dr. Chris, on the screen.
Thank you. Okay, so the immobilization principles for elephants. Okay, I think obviously when we're talking about any kind of immobilization, there's always more of a fascination for some of the big charismatic species, so things like elephants. And obviously they are enormously special animals to work with. I think for those of you guys in Malawi, obviously you know how many elephants have been moving between Malawi and Majeti and Kota and even the highlands there. So I mean, you probably should actually be teaching us on how we should be moving elephants. You've probably done several, I think just over 1,000 in the last few years. But as far as anesthesia goes with elephants, they are not particularly difficult. There's nothing particularly surprising or curveballs that could be thrown at you. And so for those of you who really enjoy your anesthetics and your complicated anesthesia protocols, unfortunately, elephants are not too difficult. Okay, it's a very, very standard procedure when it comes to darting them and the medications that we use. The biggest thing with elephants, obviously, is their size, and that is what creates the biggest problem when we're moving them. Okay, so it's very, very specialized equipment for elephants that are required. So we're only going to briefly touch on the transport side of it. We're going to be more focused on the procedures for elephants, where it's more of a you dart the animal for procedures such as putting a collar on, removing snares. If there is a treatment of sorts that's needed, like I say, any kind of procedure that's less than an hour. We'll touch briefly on transport, but the transport side, again, same as the ruminants, it's a bit of a science on its own and requires a bit more discussions. Okay, so obviously the some of the considerations which are very specific to elephants. Okay, so very, very thick skin. Okay, so we need to use incredibly long needles, okay, to penetrate basically the skin and any of the subcut fat that they might have. Okay, we spoke a bit earlier about asepsis and things like that, and again, so the thicker skinned animals, so that's elephants, rhinos, opposed to giraffe. Okay, so when you remove that needle, because of the density of the skin basically closes over that dart wound again quite quickly. That means that bacteria is trapped within that dart site. So these elephants are very, very prone to abscesses or abscessation. Okay, so it's absolutely critical that we do give them an antibiotic treatment. So you can either give topical treatment in the dart site itself. We will use an intramammary tube, anything that you give on dairy cattle. If you don't have that, you can give a big dose of duplacillin as a once-off, and that will be enough to ensure that there's no infection after darting. Okay, with elephants, posture also very, very crucial. Lateral recumbency is an absolute must. If they do go down in sternal, the biggest problem that they have is they do not have a pleural space, meaning the lungs are attached onto their ribs. So when they try to breathe, they actually need the chest itself and the ribs to be able to expand. When they're in sternal recumbency, obviously all that weight is on the ribs. They actually cannot expand the rib cage to breathe properly. So We always say if that animal does go down in sternal, you got about 15 minutes to either quickly do your procedure or wake that animal up. Okay, I know some guys have gone as high as 45 minutes in difficult terrain where they had no other option and those animals were okay, but those animals will be very, very compromised by the time you get to them. So we have a 15-minute rule. We wake up if we are not happy. Okay. Elephants are obligate intranasal breathers. Essentially, that means that they only want to breathe through the trunk. When they obviously do not have an ET tube placed, we're not going to be talking about tubing elephants. That's more from a zoo medicine point of view. So obviously now, because they only breathe through the trunk, there's some considerations that you need to think about. The first obviously is if that trunk is all wrapped up and curled, obviously there's going to be poor airflow. So the ideal is to have that trunk elongated as long as you can. We will then also take a small stick and we put that in the tip of the trunk, and that basically keeps the tip of the trunk open. Okay. Otherwise, when they start breathing without it, it actually starts collapsing. So just a small stick that you put in the trunk, and that'll keep it open. Okay. So for movement and transport, I will show you pictures, but you can hang an elephant upside down for very, very short periods. Okay, the biggest problem though that we can have when we're moving them upside down is that the entire gut content pushes up against the diaphragm and again can interfere with the breathing. Okay. When you're working with immobilized elephants, that's something you always need to think about is they are significantly prone to high blood pressure or hypertension. Okay. In days gone by, before Zaprone was routinely added into darts, there was actually a condition called pink foam syndrome, and that was essentially the blood pressure was so high in the pulmonary space that there would actually be leaking of blood from the vessels into the lungs, and obviously the elephant would then try and breathe that out, and you would see pink froth starting to come out through the trunk, and essentially that was just from the hypertension on these animals. So absolutely critical to add a Zaprone into your dart to reduce the blood pressure. Okay, so we were speaking briefly about the antagonist, but you should know this from your pharmacology, so I'm not going to speak too much about it. But in terms of antagonizing elephants, buprenorphine is a pretty poor reversal compared to naltrexone. So if you are doing transport, we normally use a combination of buprenorphine and naltrexone. And obviously, if we're doing an infield wake up where that animal can just get up in the reserve, we will just use naltrexone. Okay, bear in mind elephants are generally gregarious. Okay, so that means they live in herds. Okay, they are potentially dangerous. I don't think we need to speak more about that. The breeding herds are family units. Okay, so it's generally a mother with some of her daughters and with their calves or something like that. There's very, very strong bonds. Okay, and this obviously this has some importance when you are selecting which animals to dart and how we're going to work with these animals. Okay. Bulls can be solitary, or sometimes they're with what we call askaris. So you'll get an older elephant, so maybe in 30 to 40 years old, and he'll have some 15-year-old young bulls that will just follow him for safety and a bit of guidance. Okay, so you will occasionally see elephants on their own, but generally speaking, you'll have some kind of group structure around them. You'll see that I'm only going to pretty much have one slide on the drugs used in elephants. And like I say, it's just because it's a very standard protocol that we use. And that is a potent opioid with a Zaprone with Hyalase. Okay, so with the etorphine thionyl, you'll see that you need a little bit more thiofentanyl if you're working with elephants compared to etorphine. But generally what we do now is we're using a 50-50 mix of both thionyl and etorphine. And the reason for that is thionyl has a very, very slightly quicker induction time. Okay, so that your goal is to try and get that elephant at least standing or recumbent as quick as possible. But it's a shorter acting time. So that's why we use etorphine. Etorphine has a slightly longer induction time, but it has a longer lasting effect. So by combining the two, we get the benefit of both: a quicker induction time with the thionyl, but a longer immobilization with the etorphine. So you'll see now if we're using just etorphine for a big adult bull, 14 milligrams. If you're giving thiofentanyl, 16 milligrams. If you're using both, go to 15 milligrams as a total opioid dose, and you just go half and half. Okay. A Zaprone basically we try and say get as much azaprone into the dart as possible. If you have the highly concentrated azaprone, then at about 100 milligrams is suitable. We have found, though, over about 50 milligrams of azaprone, we stop seeing a significant reduction in the blood pressure. So just to give you guys a little bit of insight, and this is obviously all research that we've done here in South Africa, and a lot of monitoring as well, you will see that the hypertension, if you do not use azaprone, the MAP, or the mean arterial blood pressure of those elephants, can be as high as 280 to 300 millimeters of mercury. Okay, normal we want about 80 to 120. So you can see these animals are severely hypertensive. By adding azaprone, we can get our mean arterial blood pressure to about 160, which is still high, but it's much more acceptable, and you're not going to see the pink foam from the trunks. Okay. The hyalase, or the hyaluronic acid, that's essentially aimed at just speeding up the induction time even further than the thiophenol on its own. Okay. Again, the drug dosages there, you have the table now. We're not going to run into it, but essentially you can see the bigger the animal, the more drugs that's required. And as we come down, then you'll reduce your drug dosage as you're working with smaller animals. Okay. Do not be too concerned about pregnancy status in elephants. They're all very tolerant of these potent opioids. You might dart one and it might take a minute or two longer to go down than another one. That's not the end of the world. Okay. These drugs are basically aimed a little bit more than what you would require, and that's just you'll have an induction time anything from about 6 minutes to 10 minutes. Okay. All right, when we are darting elephants, okay, we need to aim for the any muscle. Okay, so we don't aim anywhere near the neck or the head. Obviously, there's big ears there, so you're not actually going to be able to achieve anything on the neck. So we kind of aim on the shoulder, or we aim for the glutes and the rump. Okay, that's going to be where you're going to get your best dart sights. Okay, the two green marks there, that's generally if you're going to be darting an elephant from the ground. The red dot is if you're going to be darting the elephants from the helicopter. Okay, so some problems that we get to as those animals become recumbent. You can see on the left that the elephant has unfortunately chosen a mud wallow, and there's a huge risk that trunk is now either in mud or in water, and so you need to treat that very, very quickly, okay, so that animal can start breathing. Unfortunately, even one breath is enough to take in enough water or mud that can actually, then that animal can end up drowning. So just be very, very careful. Okay, the picture on the right, obviously we spoke earlier about how we want the animal in lateral. This obviously is an elephant that has now gone down in sternal recumbency, and there is an embankment on the one side and a bit of a rock where that gent is walking on this side. So to try and get that animal across into lateral recumbency will be very difficult. Bear in mind, an elephant is several tons, and so even having a team of 20 people, it's going to be incredibly difficult to roll those animals in terrain like this. If it's flat, it's not too difficult, but where there's obstacles like this, it is a lot trickier. So in a case like this, work as quickly as you can and wake that animal up. That animal will be able to stand in this position, and I'll show you why a little bit later. Okay, so like we said, these are very, very social animals. Okay, so generally what's going to happen is if you dart one, be prepared to dart more. In this case, we had a mother that we needed to dart and treat for a snare wound, and her calf did not want to leave her alone at all. So you end up having to dart that calf as well. Bear in mind, a calf that size can cause severe damage and can kill people quite easily, particularly when they get very protective over their mothers. So be prepared. Never take one dart to an elephant capture. You might need to immobilize more than one. All right. Okay. So this was the elephant that I was talking about that has obviously now gone down in sternal recumbency. And because it's flat terrain, it's fairly easy to get this animal into lateral recumbency. So what we normally do is we put a rope on the opposite tusk to the side that we want down. So you can see the rope is tied here onto the left tusk. The rope then goes around the back of the neck, and then we tie it to a vehicle, which will then drive ever so slowly, and that animal will then move into right lateral recumbency. So the biggest issue, obviously, like I said, with elephants is the size of them. So in a case like this, we did use a vehicle to be able to get it into lateral recumbency. An elephant in this position, I did mention a bit earlier, but I'll add it again now, 15 minutes. Do not leave this animal in this position for longer than that. There is a lot of compression on the chest cavity, and this animal's respiration is going to be compromised. All right, so this is an elephant in a very, very good position and great posture. Okay, so we're obviously in lateral recumbency, which is what we want. The trunk is extended and unfortunately it's just cut off, but you would see a little stick that would be opening the tip of the trunk. And then, like I was just talking about, is unfortunately we cannot use blindfolds in elephants, obviously, just because of the size of their head. So what we do is we will flap the ear on the top over the eyeball that's on the top. So you can see there the left ear is now, the right ear is over the right eye. The eye underneath, unfortunately, that eye just remains without any blindfold or anything like that. If you are concerned about dirt and dust, just before you reverse the animals, you can flush those eyes with just some saline or something like that before you wake them up. All right, so I've just included this picture again. Obviously, this is a really good posture. This is an elephant that was done from a helicopter. Okay, so what I want to just get onto now is just some of the important aspects of helicopter darting. Sorry, we'll do monitoring first, then we'll come on to the helicopter. Okay, so with elephants, even more so, monitoring is incredibly limited. Okay, so first thing here, we can see there's a pulse ox that's attached onto the elephant's ear. It doesn't work just by applying that crocodile clamp onto the tip of the elephant's ear. Okay, there's too much keratin in the layers of the skin for basically the way that probe works. What you need to actually do is you take a small blade and you actually need to slough off the top layer of the epidermal or the epidermis. Okay, don't make it bleed, otherwise, again, that won't work. But you will essentially just remove a few layers of skin, and then you can apply that pulse ox. It's very limited though. We don't get it to work every single time. If you are able and you've got a more advanced monitoring equipment, which we very lucky we do, you can very easily get an artery. Okay, so in an elephant's ear, okay, you can obviously see even from this picture all the different vessels. You can very easily palpate the difference between a vein and an artery. Okay, the biggest difference obviously is that a vein is a little bit bigger, okay, but it is much softer to palpate. Okay, so obviously that's just blood returning to the heart. The arteries, they're quite a bit harder. Okay, so obviously the layers around the arteries are more aimed at contracting to push the blood further away from the heart, and obviously dealing with the high blood pressure. So you can very easily place an intra-arterial catheter that you can then do, like we said earlier, you can do oxygenation levels by sight, looking at that, or you can even apply one of the blood pressure monitors that works via an arterial line. The biggest issue with all of the equipment for monitoring is just getting them in the field to the elephant. Okay, so this is our monitoring equipment that we use. Okay, it's called a Mindray, and essentially it actually does anything that you need it to do. Unfortunately, they are very, very expensive, but it's just something that we that we have access to, that we can use it. We do not use it on every single elephant immobilization. I can guarantee you that. It's only for specific cases. If we are worried, let's say, about the health of the animal, or if it's going to be a very long procedure. Okay, so we are starting to do some longer procedures in elephants, and that is when we will do we'll take our monitoring equipment so that we can obviously ensure that it's going to be safe for several hours whilst under immobilization. Be very careful, obviously, when we are on lateral recumbency. Okay, so in elephants' ears, this is our one of the biggest things that we see, that if they do go funny down onto their ears like this one, that cartilage actually ends up breaking, and that animal will then have a permanent deformity in its ears. So if you can, and you've got enough hands, or if you've got a vehicle, you try and correct that by just ever so slightly elevating the head, that you can pull the ear flat. Okay. Unfortunately, though, it's not always possible, and that's just one of the risks, unfortunately, with working with such a heavy animal. Okay, next slide, please, Maret. Okay, so now just kind of getting onto some of this, the aspects of from, like, let's say, like a helicopter, or even from the ground. when we are darting the single bulls, okay, so you might think that a bull is all on his own, but be careful. They don't always stand close together. They can be a couple 100 meters apart. But if there's any threat, they can very, very quickly group together. So always bear that in mind, is if you're going to dart a single bull, there might be other bulls in the area. If you're darting from the ground, that's where there's the biggest issue. Okay, so obviously now you dart that animal, it goes recumbent, you walk in, there's no way that you can tell if there's more elephants moving in. And that's often why we prefer darting from a helicopter. That way, when the elephant is recumbent, the helicopter keeps on flying and can actually keep pushing any of the other elephants away. That's more important when you're working with family groups, but it is also consideration when working with the big bulls. One of the things that you get quite interestingly with the bulls, once you've darted them, is they often almost go to become immobilized or look like they're sleeping whilst they're still standing up, and you can actually approach them and almost push them over. Okay, that normally happens at about 10 minutes. You'll see the kind of signs that you'll see is their shoulders drop and their trunks will be on the ground. Okay, that animal is essentially immobilized, but they're just standing. They're very safely or can be approached very safely. That being said, though, I would only do that once you have been with someone who's very experienced with working with elephants, so you can obviously learn some of the signs that these elephants are showing to safely know when to approach them. With the family groups, like we've said, obviously very, very strong dynamics and social bonds within that group. To a point where sometimes it's not only the calf that will stay with the mother, but the whole herd. And that is when a helicopter becomes absolutely critical, that everyone can safely approach those animals to work on them, but there's no risk of the rest of the herd approaching. And I can guarantee you now, it's happened multiple times where the herds do come back and they have to be pushed back with the helicopter. And if that's the case, it's not just a case of flying off and the elephants run off. They will keep circling back. They'll keep circling back. So you need to speed up your procedure and wake that animal up. Single bulls. Okay, so this one you can see, it's difficult obviously to say from just a picture, but that trunk is now flopped on the ground and the shoulders, I can tell you now just from knowing, they are slightly dropped. So that animal is actually now safe to be approached. The other thing with the big bulls, and I apologize for the ladies, I know this part might be a bit rude, but when we're using a drug like azaprone, that actually ends up in a paraphimosis-like state. So basically the penis comes hanging out. And if you look very carefully at this elephant, you can see that penis actually has become or is now hanging out. And that is a clear sign that the zaprone and is working in that animal as well. And now that animal is safe to approach. Okay, so again, these single bulls are generally the easiest to work with. Again, this one is standing. The purpose of this picture is to show that helicopter is actually very, very close to that elephant. When they get to this stage of the mobilization, you can literally land a helicopter right next to that elephant and it's not even going to move. Okay, it is completely immobilized now. They have what's called a stay apparatus, which is similar to horses, where actually their joints start locking. And so they can actually be fully asleep while standing. And that is what we are seeing here. So you cannot push these animals anymore with the helicopter at this point. You might as well land, and then you can start working on those elephants for whatever procedure needs to be done. Okay, loading bulls. I'm not going to spend too much time on this. This is a very, very specialized procedure. But like I said earlier, you can safely briefly hang these elephants upside down to move them from the ground onto a truck, and then you put them back into lateral recumbency. Things that you need to be very careful about, though, with this is if it's going to be a long procedure, be very careful of the weight that's going to be on the legs. Okay, so you might see things like pressure sores if you are not if it is a long procedure and that animal's weight is all, let's say, on the legs. So you can see in that bottom right picture, there's a tire that's just aimed to just help the not put too much pressure on that hip there. The other thing is in the middle photo. Okay, so you can see there, if you look carefully, the front legs are ever so slightly elevated compared to the back legs. Okay. The reason we do this is to then all the gut organs, so the stomach and the liver and all the heavy things, actually are then pushed away from the diaphragm. Okay. If it's the other way around with the back legs higher than the front legs, all of those organs then push up against the diaphragm, which can lead to respiratory complications. Okay. The very important thing as well that I should have actually said first, because it is the most important, okay, whichever side or whichever lateral recumbency that animal is on the ground, that is the side that that animal must remain on the truck. Okay, do not roll these elephants over. With all that weight, what we see is quite an intense pulmonary edema, which obviously then does affect gaseous exchange, and that's generally on the ventral lung or the bottom lung during an immobilization. If you now roll that animal, that lung is compromised, and it is now the lung on the top that now is essentially meant to be doing all the gaseous exchange. It is compromised, and that animal will not have suitable gaseous exchange and will end up dying without a doubt. Okay, so do not roll the elephants during a immobilization. So if they're in right recumbency from the ground, keep them in right recumbency on the vehicle. Do not change the size that they are lying. Okay, so I'm just going to go through a quick recovery here and why that first elephant in sterno would have stood. So the biggest thing to remember is that elephants use their front legs to stand first. Okay, and then they will kind of get into a bit of a dog sitting position, and then they'll lift the back legs. What you need to be a bit careful of is the very, very big bulls, okay, with very big tusks and obviously very heavy heads. They can struggle to stand. Okay, so if that's the case, you need to consider it, and this is obviously a consideration before waking that animal up, is actually putting a rope around the animal's neck, that if you need to help it, you can get a vehicle to pull that rope ever so slightly, that as they start getting up, you can then cut the rope and move off. Okay, so you can obviously see now it's and again we can keep going. They're getting more into a dog sitting position, so they use the front legs. They'll often throw their trunk up, and that's all just basic physics to try and get into the weight in the correct position, and then they will stand up like that. Okay, all right, so once they've stood in that situation, this is when it is suitable and advisable to move away pretty quickly. Okay, particularly with the bulls. Sometimes they can be a bit aggressive. They wonder, who caused the trauma that they've just been through, and they'll end up charging the vehicle. So as soon as that animal is standing, move away quite quickly. If there is a helicopter, we will actually have all the vehicles move away beforehand, and we will monitor that animal from the air. So it gets a bit more complicated now with the family groups, particularly when you are trying to capture the whole group or doing a treatment. Okay, so this just comes with a bit of time and expertise. And if there are rangers and monitors on the reserve, this is where their knowledge becomes very, very important. Okay. Elephant herds basically have a matriarchal society. Okay, so it's kind of ruled and led by a single elephant female, and like we said, it will be a group of maybe some of her sisters and some of her daughters and all of their calves. Okay, when you are working with them, the basic principle is that you need to immobilize the biggest animal first and then work your way smaller. Okay, you need to take the matriarch or dart her first. That way that the herd will actually gather around her when she becomes immobilized and becomes a lot easier to work with. If you dart one of the other animals first, initially what happens is that matriarch can actually take that herd to safety, and then she can even come back to come and assess the danger of what's happened to that one elephant. And that's obviously when it can become quite dangerous then for the people on the ground. So we will generally, if we're working with a whole herd, we will take out the matriarch first. If it's not the matriarch that needs to be worked on, or one of the calves of the non-matriarchs, there is an opportunity to dart that mother and that calf, and then have the helicopter just keep them at bay. But it'll only work for some time, and then that matriarch will want to come back and check the safety of those animals. There's very, very specialized equipment, and I'm not going to go into all of this now. Again, this is a huge discussion all on its own, moving of elephants, but it's very, very important when you're moving the herds, you try and keep family groups together. That reduces the stress significantly. Okay, if you start loading the females separately from their calves, you can get a lot of fighting from those animals trying to get to each other. Okay, loading bulls on their own, that's absolutely fine, but this is all very, very specialized equipment, and there's not a lot of these trucks available. There's 2 or 3 within South Africa, And as I'm sure as the Malawian guys know as well, these were all shipped up or driven up to Malawi to assist with the big elephant relocations. But essentially, the take-home message here is that you don't just move elephants without a lot of planning and preparation and getting experts involved. Let's say this is the herd that we're wanting to immobilize, and let's say in this case it's for transport. Okay, so you quickly need to now try and assess who belongs to who in terms of the mothers and the calves. Okay, so you can really see in this group there's some clear splits here. So you'll see in the kind of the elephant on the top left, you'll see that there's a very small calf at her foot, and then there's a slightly bigger calf just on her right hand side. So those are probably her very new calf, and then her slightly older baby that's a couple years old. Okay, then you've got the mother also with 2 or 3 calves there on the top right hand side. Whilst you're in the air, this is when you need to start making the decisions about who's going to be darted first, and if it's from a herd point of view, or if it's from a point of view of just darting 1 or 2 individuals out of this group. So the general rule of thumb, let's say we are darting this whole group, is we start with the biggest animals and we then start working our way smaller. Okay, so we can go to the next slide there, please, Marietta, or the next kind of pictures. Okay, so these things are a little bit off center, but anyway, you will start with the biggest animals. Okay, so the top right, the top left, and the animal that's kind of in the foreground, the closest one. Okay, once those 3 animals are darted, you will then start with the sub-adults. Okay, the absolute last animals that you want to be immobilized is those very small calves. And that's also from a point of view that you do not want the adult to fall on the small calves. Otherwise, that will completely squash them. Okay, so you can actually wait for the mothers to become recumbent. Those small calves will not leave their mother's side. Even if there's a helicopter, even if there's people, they're not going to just run off. They'll stay very close by. You can then dart those animals right at the end, and then there's no risk of any of the bigger animals falling on them. Okay, so this would be a time, if I was with you guys, where I'd be asking about positioning of this animal, if you'd be happy or not. And obviously you would then tell me, no, that this is all wrong. This animal's in sternal recumbency, and you would want to get it into lateral as quick as you can. This is definitely a situation that's very easy to get this animal into lateral recumbency, so there shouldn't be any problems at all. So we can only do very basic monitoring, like I say, when we've got big groups down, or just from the point of view of taking these all the equipment into the field with us. So the first thing that you want to do, obviously, the position of the trunk. Okay, so like we showed in that earlier picture, we want that trunk to be extended and open by a little stick. And then we can monitor respiration quite easily. Okay, just bear in mind when we're using the potent opioids, there is respiratory depression. So if, let's say, we'd be expecting in a fully awake elephant to maybe have a respiration rate similar to that, let's say, like of maybe like a horse, something between anything from 16 if it's at rest to 40, 50, maybe a little bit more if it's moving. When we are working with these animals, anything 4 to 8 would be considered normal when working with the potent opioids. But bear that in mind that 4 is very low, and we are in a period of respiratory depression, and so these animals potentially could be hypoxic as well. Okay, so respiration, obviously, that's the most obvious thing to do. Heart rate, elephants are going to be very difficult to actually auscultate the heart. Just if you are lucky and you can actually hear, let's say on one of the younger ones, there's generally so much noise around, particularly if there's trucks and people talking, that it's not worth it. So they obviously have really big arteries in the ear, and so you can actually you can do a pulse palpation very, very easily from just the ears. Okay, temperatures. Again, we will not monitor every single elephant, but as it's getting hotter in the day, as soon as we get to about 40 degrees, that's when we will then call it for the day. Okay, so the sampling and other procedures, this is obviously why we immobilize elephants, okay, and obviously as transport's included in that, okay. But these need to kind of be beforehand discussed. So as with any wildlife procedure that needs to be done, there needs to be a good briefing beforehand, that everyone knows what to do beforehand, so that when we approach that elephant, it's as that animal is down for as quick as possible. And obviously that's more aimed at the fact of the recumbency. Okay, so if it's sternal and we cannot get it out of sternal, we then want to be able to do these procedures very quickly. Obviously, if it's lateral, we do have a bit more time, but you want to obviously know exactly what you're doing with this elephant before you go ahead and do this procedure. Here's just a quick photo of the family units in a crate. Okay, so you can obviously see in this case they are actually fairly relaxed. Okay, I just put this slide in, and it's for a lot of species, particularly your social species. A lot of people ask me, what tranquilizer can I use for elephants or for buffalo or for impalas? At the end of the day, these animals just want to be with their family mates. Okay, and so even though there are drugs that can help tranquilize, nothing is as effective as actually just giving those animals their families back. Okay, so yes, we will give some tranquilizers to maybe the adults, but the youngsters, they're going to be calm just because they are with their mothers and their aunts. Okay, so the transport again, very, very specialized way of doing things. So if you are wanting to go into elephant transport, the most important thing is to just jump on the teams that are doing it regularly. Malawi, I think you guys are probably not going to be moving too many elephants anymore after the number that you've done, but there's still a significant number of elephants that are going to be moved in Africa in the coming years. Okay. Just things to consider, obviously, like we said earlier, bulls you put on their own, family groups you put together. Be very careful of mixing different family groups, though. Okay, so it's not just a case of you dart a family there and dart a family there, and you can put them all together in one crate. Those matriarchs might actually start fighting just because they're a bit threatened by each other. Okay, tranquilization. The tranquilizers that we prefer to use in elephants is a combination of haloperidol and perfenazine. And if those animals are a little bit agitated, you can give them regular top-ups of azapron. Okay. Elephants, they are one of the species that for long periods of transport, you can actually give them some food and water once you stop, and they are quite used to it and will eat and will drink. Other small antelope, things like impala, very unlikely. They're so stressed in that phase, just rather drive quickly and get them off. Okay. Offloading of any large animal, be very careful. Sometimes they will come quickly off the truck. They will then turn around and come back for the trucks and the crates, because that's who they believed have hurt them, and they want to get their own back. So the offloading, just be very, very careful. All right, I think with elephants, again, this is probably topics that I can speak on for 2-3 days. And again, with elephants, it's much easier to teach when we have an immobilized elephant in front, and we can talk about all the various aspects. And obviously there's a lot that I wasn't kind of able to discuss with you guys now. But yeah, if there's any questions now, happy to try and answer as many as I can. But the big thing with elephants, I hope what you got from here is that the anesthetic immobilization is actually the most simple part of working with elephants. It's the social structure, the nature, and some of the, let's say, anatomy and physiology of elephants that makes them slightly more difficult to work with.
Thank you so much, Chris, for the presentation. We have really learned a lot. And I can see we already have some questions in the charts. Let me just get to the charts. How do I make my chart bigger? Okay. Okay, the first question was from Clara. Clara is asking, the first table that you had with drugs, where you had the female and the male, she's asking where those dosages in milligrams per animal.
Yes, those are in milligrams, correct? Yeah.
Yeah. And then there is a question from Claire. Claire is saying, on the single boot darting, there was a point that often stands before recumbency. I didn't understand that. Would you please come again on that one?
Okay, so what I mean by that is we explained a bit about the stay apparatus. So that animal is actually completely immobilized. So in terms of whether it was standing in that way or if it was in recumbency, the level of immobilization is actually the same. So generally what happens, let's say with the calves and the cows, once you've darted them, they will actually fall down on their own. What you can get with the bulls is they actually just stay standing, even though they're completely immobilized. They're completely sleeping, and you actually can then go and push them over yourself. So it's basically that stay apparatus where their joints, essentially joints, tendons, ligaments, kind of get into a bit of a lock, and they are fully asleep whilst they stand. Because bear in mind, most elephants, you might see some of the youngsters sleeping on their side. Most elephants, particularly the adults, they will sleep whilst they're standing up. Okay, so the reason why I've included that is, don't think that, oh, this elephant is still standing, the drugs didn't work. There is a chance that, or most likely, that elephant is actually sleeping, but it is still standing.
Okay, thank you so much. And moving on, another question is from Renate. Renate is asking, what is the best way to monitor the elephant's temperature?
Okay, so Renette, so you might know, I hear you from South Africa. So Chiron Labs, they actually make us quite a long probe. Okay, so you obviously, you've seen the short little probes for humans and for small animals, and that obviously is not going to work in elephants. But for things like rhinos, hippos, giraffe, and elephants, they actually just make us a longer probe. So it's done rectally as well, and that's the best way that we do it.
All right. Thank you so much. Moving on, there is a question from Clara who is saying, are the spray paint numbers on the calves to group them together with their respective mothers?
So when we're working with the big groups, essentially it's part of grouping them with their mothers, but it's also from a monitoring sheet. Okay, so we all have a big sheet. Let's say, we can have 10, 11, 12 elephants down at a time, and we will then spray a number on every elephant that we'll have a scribe who will then say, elephant number 3 last had a top-up dose of atropine 20 minutes ago, it might start waking up. So it's basically more from a monitoring point of view, but we definitely use it then that we can know who's mothers and who's calves as well.
All right, thank you so much. Just a reminder to our audience, if you'd like to ask your question on your own, please feel free to raise your virtual hand. All right, so I will continue reading the questions. There is another question from Judith Sululu. She says, what did you say on the tranquilizer we can use?
Okay, so during transport, okay, again, before doing any elephant transport, I think it's worth either having a much longer lecture on it or joining a team. But just very basically, we can use perfenazine, okay, which we spoke a bit about with the ruminants, haloperidol, okay, those are 2 that we would give routinely as that elephant is now standing in the truck. And then for routine or regular intervals, if that animal is starting to get a bit agitated, we will then give a Zaprone every 2 to 4 hours if required.
Okay, thank you so much. Another question from Renette. When darting an eschary group, can you separate them, for example, during transportation, or are there bonds like that of the family head?
Yes, the scaries you can definitely separate. When you are traveling with the bulls, it's you can, large elephant bulls travel, put them on their own. Okay, that they are so big and so strong, and if they do feel a bit agitated, they can very, very quickly kill smaller bulls. But if there's 50, a group of 15-year-old bulls which are not very big, you can put them together. That's not going to be a problem. So it's mainly aimed at separating the very, very big bulls on their own.
Thank you so much. And there is another question from Dr. Boaz. Dr. Boaz is asking, could you please explain what causes the pink foam syndrome in elephants during anesthesia?
Okay, so the pink foam syndrome, that is, we don't see it much anymore since the inclusion of a Zaprone routinely in the darts. But there's kind of twofold. Okay, so the most important thing is, if you go back to your basic pharmacology, your opioids actually induce hypertension. Okay, so they can cause a hypertensive like state. And obviously an elephant, also being a very big animal, they obviously have I want to say, like, they've got quite a unique cardiovascular system in order to pump blood to the far extremities. Okay, so because of those 2 reasons, what we saw is the blood pressure from the that arose from giving a potent opioid, what happened is in the lungs themselves, that you obviously have capillaries that go around your alveolar that for gaseous exchange. The blood pressure was so great on the arterial side that they would actually start leaking fluids through those capillaries into the alveolar. So it's actually almost bleeding in a way into the lungs. Okay. Obviously, then an animal is trying to expire. It would be trying to breathe normally, but now it's trying to get rid of some of this now buildup of blood-like fluid in the lungs, and that would then start coming down the trunk. And the reason why we only saw it in the trunk is because, like I said earlier, elephants only breathe through the nose or through the trunk. They do not breathe through the mouth. Okay, so that's why all of this content started coming down the trunk, and that's why we started to see this pink foam. So it's all a result of hypertension, which was drug induced and from their anatomy. Okay, but by just giving a Zaprone, we do not see it anymore. It's nothing to be worried about. But I have been to countries in Africa where a Zaprone was not being routinely in those darts, and we've encouraged them to obviously start using those Zaprone. So if you ever work with elephants and you're using potent opioids, please use the Zaprone in your dart as well.
Thank you so much. And I also have a question. I'm just curious. You mentioned about starting to do longer procedures in elephants, and I'm wondering what can those long procedures be that can be naturally caused, because you said you only treat when it is caused by humans but not natural. So what are some of examples of the longer procedures that you're starting to do in elephants that are not naturally caused?
Okay, so I'm going to just talk about one procedure that we're starting to do. Okay, and it's very, very new. But obviously, for all of us living in Africa, we know that unfortunately elephants are one of the biggest culprits when it comes to human and wildlife conflict. So they leave the confines of the reserves, and they will then go and get onto farmlands and things like that. We are needing to now try and think of different ways to prevent elephants from escaping out of their reserves or not getting into fenced out areas. Okay, so what we've started to do now is elephants are obviously, we do not need to talk about their intelligence. They are very, very clever. But what we had is some reserves were starting to put up electric fences to try and prevent animals obviously escaping, or they were putting electric fences around an area that needed to be protected. The problem that we were seeing, it was mainly at the very big bulls, is their tusks were not conducting electricity as well as the rest of their body. So what they worked out is that they could break electric fences simply by using their tusks. Okay, so the problem was still there. So what we have attempted to start is we actually will immobilize these elephant bulls, the big ones, okay, and we will actually implant a bit of wire, okay, that goes down basically along their tusks and into their lip. Okay, so it's all externally. Okay, so it's not invasive. It's just basically wrapping a wire around the inside of the tusk, so you can't even see it. And that way, that if those elephants try and touch an electric wire, that will actually conduct the impulse onto the lips where it's more sensitive, and that elephant will then run off. So it's still very, very new, and we've only done 2 or 3 of them at the moment, and we've got a whole lot that we're going to start doing now. But unfortunately, the other options, if we don't intervene with something like that, is a lot of these elephants will then have to be euthanized, okay, because they do become problems, and they do run into issues with people. So that's something that we're attempting at the moment, and that procedure can take, let's say, 2 hours or so to do.
That's very interesting. Yeah, it has no effect to the elephant behavior, or is the shock cannot cause any harm to it if the wire is inside the tusk.
No, so it's a mild shock. I mean, like humans, if we touch an electric fence, it will shock us, but we're not going to die. And all it's aimed at doing is just trying to that elephant now knows, okay, I'm not going to break through this fence. I can't get through here. I'll respect it.
That's very interesting. Thank you so much. I see we have another question in the chat, and this is from Dr. Boaz. He's asking, could you please explain? Oh no, this one is the old one. Okay, let me just go to the new one. The new one is saying, is there a risk of translocating elephants to far places? Does it pose a death risk to them, especially for the bulls during transported that are being transported alone?
So if you are transporting elephants very, very far, let me go one back. Sorry, if you're moving elephants very close, so if it's an elephant that has broken out of a reserve and it's going to be an hour or two to relocate that elephant back to that reserve, you can actually put that elephant lateral on a truck and keep it sleeping just by giving regular intravenous top-ups, and you can then wake that elephant up on the reserve. If you are transporting them very, very far, then wake them up and have them standing in a truck. Okay, and you can actually transport them for quite a significant amount of time. Me personally, I've never done more than an 18-hour journey with elephants. The problem that you start getting to that you need to consider, obviously, is giving them enough food and enough water. You can only, during transport, it's difficult to kind of give them enough. I think with any translocation, death, unfortunately, is always a risk. But it's it's always there. But bulls being transported alone, that's certainly safer. If you're putting bulls in with, let's say, younger animals or herds, then there's certainly a death risk. One of those youngsters, that bull, unfortunately, might stand on it or get aggressive with it. There's certainly a risk. But for far transports, having them awake in a truck, you can actually take them quite far with very little risk to those animals.
Thank you so much. And right now we are at the end of our session. I would like to thank Dr. Chris Smith for his time and for sharing his knowledge with us. We are really grateful, Chris. We have learned a lot. Now we're going out there thinking like we have worked with an elephant and the small ruminants. And you have also encouraged us. Like some of them I know from here, they would like to go into the bush and work with elephants, just like you.